Hello and welcome to the Frank H. Netter MD School of Medicine's Class of 2024 Virtual White Coat Ceremony. We are excited that you are able to join us. This year's ceremony is different from previous years, but it does not diminish the significance and importance of our students' accomplishments on their journey to becoming a physician. Please join me in welcoming Bruce Koeppen, Dean of the Frank H. Netter MD School of Medicine at Quinnipiac University, to begin our program.
It is my pleasure to welcome you to this virtual white coat ceremony for the members of the class of 2024 at the Frank H. Netter MD School of Medicine. I am Bruce Koeppen, and I have the privilege of serving as the school's dean. In the absence of the coronavirus pandemic, this ceremony would have taken place this past August as the culmination of your orientation activities. We chose to delay the ceremony at that time with the hope that we could hold it in person at a later date. Unfortunately, and for everyone's safety, your white coat ceremony, like your welcome ceremony back in August, needs to be virtual. It is my hope that this format does not diminish for you the importance of this ceremony, which traditionally marks your entry into the medical profession. The white coat, like the stethoscope, is a well-recognized symbol of the medical profession. Depending on your career path, the white coat can be part of your professional identity. But your professional identity will not be the result of what you wear. Rather, it will be the result of who you are. Much has been written about professional identity development of physicians. The foundational elements of your professional identity include clinical competence, communication skills, and ethical and legal understanding as it applies to the practice of medicine. The Netter faculty will certainly help you make these elements part of your professional identity. However, these alone are not enough. In addition, you must embrace excellence, humanism, accountability, and altruism. Professional identity is not one size fits all. Each and every one of you will have your own unique professional identity. Certain aspects of your professional identity will be shared with other physicians, but much of your professional identity will be shaped by who you are as a person, as well as by your unique life experiences. As you receive your white coat, I want you to think seriously about what you will do to shape your professional identity. The process begins with Netter, but it will continue throughout your residency training and as well as throughout your career. To start you on your journey, and to be clear, the development of your professional identity will be a long journey. The school has set expectations based on the following principles, which are also the pillars of the school's code of conduct. These principles are compassion, duty, honesty, integrity, respect, and professionalism. These principles should guide everything you do and every interaction you have, whether it's with your classmates, faculty, staff, resident physicians, or, and most importantly, patients. As members of the medical profession and also the Netter family, you are expected to embrace these principles, not just when you are in class or when wearing your white coat, but in everything you do privately and publicly. Because if you do this right, your professional identity becomes integral to who you are, not just as a physician, but as a person. Your professional identity cannot be put on or taken off like your white coat. You must wear it all the time. Members of the class of 2024, I wish you well as you begin your journey to develop your unique professional identity. And I wish you much success in your careers. Congratulations on being a member of the class of 2024. Thank you. Now it is my pleasure to introduce Quinnipiac University's president, Dr. Judy Olian.
Hello, everyone. I'm extending a warm welcome to you, our incredibly talented first-year medical students. You're joining the Quinnipiac Netter School of Medicine, which has fast become a much-admired medical school in just a few short years. For sure, I'd much prefer to be standing with you in person, feeling the palpable excitement as you put on your white coats and receive your stethoscopes. But we'll not let this moment in time rob you of this special, unforgettable occasion and milestone it represents in your journey to become a doctor. As Associate Dean Konopasek will shortly explain, the white coat ceremony dates back long before any of us were around, and global wars or pandemics never stopped it before. The white coat ceremony is timeless in celebrating the values that are embedded within each of you, that make up the constitutions of ideal physicians. Your selfless devotion to the lives of others, even to the point of sacrificing one's own. Your commitment to bring science into practice. Your compassion and human touch to alleviate the most basic of fears around illness or the sorrows of a lost loved one. As you likely know, our world needs more doctors now more than ever, with dramatic and stark shortages in almost every specialty in the medical profession. You also need to bring broader sets of skills into the practice of medicine. Data analytics are transforming the science of medicine and are now integral to preventative medicine, to therapeutics and the treatment of chronic and serious disease. Knowing how to apply the most current and data-driven scientific insights is a vital ingredient of your QU Netter education, just as is the human side, knowing how to treat the full person, the physical, cognitive, and emotional elements that are all critical in leading to good health. Speaking of which, we care a lot about good health here at Quinnipiac in the fullest sense of the word. I believe that here in the Bobcat family, we enjoy a level of caring and kindness that's very touching. It's welcoming and serves communities broadly, both inside the university and around us. And while I know your days and nights will be filled with lectures and long hours in the library, exams and rounds, please remember there is more to life than an anatomy textbook. Take in a guest panel on changes in the food industry due to COVID, or grab a socially distanced coffee with a new friend, or watch a basketball game in person once our world opens up, hopefully in a few short months. I can virtually guarantee you, and I don't say that often, your educational journey at Quinnipiac will be transformative. Not simply because of what you'll learn about the medical field or because of the lifelong friends you'll make, but also because of what you'll learn about the interconnections between medicine and other related fields like public health, public policy, sociology, psychology, economic and educational inequality, and even the arts. But most importantly, you'll be transformed because of what you'll learn about yourself. What is the essence of you? Who you want to be, and how you want to have impact. In the meantime, while you figure all that out, let me just say once again, welcome to Quinnipiac University, to QU Netter, welcome to our family. Thank you for being a part of our community, and congratulations on the official launch of your journey toward becoming a physician.
Greetings to the medical school class of 2024. To your families and friends, your significant others, to your faculty and deans. You begin medical school in a time of great chaos and uncertainty, which will only increase your roles as medical student and then doctor. During this historic time, we come together today to recognize the unwavering core of healthcare, humanism, our collective humanity, your humanity. The White Coat ceremony was created in 1993 by the Arnold P. Gold Foundation to mark this moment in your journey as a physician, to recite an oath to recognize your awesome responsibility to the patient in front of you, and to emphasize the importance of compassion, respect, empathy, and ethical patient care.
This ceremony takes on special meaning as we continue to be in the grip of a global pandemic and dealing with the persistent and difficult racial inequities in our society. So in this context, your humility and your ability to see the humanity that is part of medicine is more important than ever. How clearly I remember when I first put on a white coat in early clinical encounters in medical school, how humbled I was that the patients assumed that I was knowledgeable and trustworthy, and how much I wanted to earn and realize those attributes. So I hope that as you go forward on your own individual medical journey, you will remember the importance of lifelong learning and the importance of humility and the importance of what is called a beginner's mind, an openness to all possibilities. So as your journey continues, I hope that you will maintain your humility and a beginner's mind, and I congratulate you and welcome you to the world of medicine.
At this critical moment in history, as we are dealing with an unprecedented pandemic, we are also called upon to address the sweeping xenophobia and racism that harm the health of so many and cut short millions of lives. And so it is particularly poignant that we introduce Dr. Vivek Murthy to present this White Coat Ceremony's keynote address. Dr. Murthy served as the 19th Surgeon General of the United States and is the best-selling author of Together, the Healing Power of Human Connection in a Sometimes Lonely World. Dr. Murthy also served as faculty member at Harvard Medical School and founded multiple nonprofit organizations. Dr. Murthy is the 2020 recipient of the Wilshire Gold Award for Humanism in Healthcare, which is a joint honor bestowed by the Gold Foundation and the Wilshire Foundation, recognizing extraordinary contributions of immigrant healthcare professionals. Earlier, Dr. Murthy received the National Humanism in Medicine Medal from the Gold Foundation, and he is the Gold Humanism Honor Society member. To the members of the medical school class of 2024, congratulations again on the start of your wonderful journey as physicians. Please welcome the keynote speaker, Dr. Vivek Murthy.
Congratulations, class of 2024. It is an honor to be with you as you begin one of the most exciting and consequential journeys of your life. When you first set your sights on becoming a physician, no one could have imagined that you would be joining the profession during one of the most surreal moments in our lifetimes. COVID-19 has transformed our lives. It has also underscored the important role that medicine and public health play in society, while also making it painfully clear that we have more work to do to create a system that cares well for everyone. COVID-19 has reminded us how much the health of a few affects the health of all. It has reminded us that poverty, racial injustice, and access to clean water and healthy food have profound consequences for our health, often more so than the decisions we make in clinic or the hospital. If we want to be healers in the fullest sense, if we want to not only treat disease and suffering, but also prevent them in the first place, then we must broaden our charge as physicians. We must care not only for the patient in front of us, but we must also seek to understand and address the underlying factors that drive illness in our communities. We must do this through our research, our teaching, our direct service, and our advocacy. There is one more thing this pandemic has reminded us of, a lesson that will be invaluable to you as you navigate the choppy waters ahead. It has reminded us how much we need each other. Our relationships are far more powerful and consequential than we may think. The more we study social connection, the more we realize that when we have people in our lives we trust and love, we are happier. We are also healthier. We perform better at school and at work. And we are better able to dialogue with one another, which has implications for reducing polarization and increasing cooperation. Our relationships, it turns out, are the foundation on which we build everything else. But as essential as our connections with one another are, they are often the first to suffer in our fast-moving world, where the pursuit of work and achievement often displace time with family and friends. I say that as someone who, for many years, allowed training and work to distract me from the people who mattered most, something I have worked hard to correct in recent years. Despite all the uncertainties and ups and downs you will encounter in the years ahead, my hope is that you will always make your relationships your top priority. Our relationships are our anchors. Keep them close. Fight for them. Pick up the phone when a friend calls, even if it's for 30 seconds. Visit your family and close friends, even if it's for a short while. Remember that even when you have only a few minutes to spend with someone, you can make that time count by giving them the gift of your full attention and your full presence. I leave you with one final thought. I want you to know right here and right now that the most important qualities you need to be a healer are the ones you had even before you entered medical school. Your ability to care deeply for others, your ability to listen with compassion, your ability to lead with love. Despite what the world may tell you, you are enough. You don't need to publish papers to be worthy. You don't need to receive awards or ascend to powerful positions in order to be a good doctor. It is in our intrinsic ability to give and receive love that we find our humanity and our true power to heal. I hope you are always surrounded by people who love you. I wish you many moments of laughter and joy in the journey ahead. May you have lives full of inspiration, full of peace, and full of happiness. Congratulations and good luck.
Thank you, Dr. Murthy. I'd like to join Dean Koeppen and President Olian in welcoming the class of 2024 to our white coat ceremony. And I'd also like to welcome parents, family members, and friends, and all who helped this talented and dedicated group of students reach this momentous occasion. You have chosen to enter the medical profession in a pandemic, at a time when you are desperately needed, and your white coat will be seen as a beacon to those in need. Your decision to don your white coat demonstrates tremendous courage and commitment. The white coat is truly a powerful symbol. It defines us, it unites us, it gives us authority, it makes the promise of duty and expertise, and confers the awesome responsibilities of our profession. Those responsibilities, as outlined in the physician's charter, include commitments to professional competence, to honesty and confidentiality, to improving the quality of care and of access to care, to ensuring a just distribution of finite resources, and to furthering scientific knowledge. All of these commitments are grounded in the fundamental and noble principles of the primacy of patient welfare, patient autonomy, and social justice. Principles that are more important than ever. The power of the coat is felt both by us and by those who see us wearing it. When you wear it, many will assume that you are already a doctor, ready to be trusted to serve, to care, and to cure. And while right now your diagnostic and therapeutic acumen is in its infancy, I know that you have arrived at Netter not only with the intellectual horsepower to become spectacular doctors, but also with a tremendous capacity for serving, caring, and compassion. All the right stuff to become outstanding physicians. Some of you have looked forward to this day with confidence, knowing that you finally look the part you have been preparing for. Others may feel uncomfortable. You may not feel like a doctor yet, more like an actor. You may even feel like an imposter. This is all normal. The coat is your new professional skin. You will grow into it. Each and every one of you belongs here at Netter. In coding you, we affirm our confidence in you, and we welcome you to the profession. The white coat was first worn in the 19th century. Before then, physicians wore black because it was considered formal and appropriate for the serious matter of medicine, which in those days often led to a negative outcome. At that time, people did not seek medical care preventively or for minor issues, but usually for serious diseases, and it was often believed to be a precursor to death. By the late 19th century, the idea of antisepsis, the prevention of infection by creating a sterile environment, was emerging, and the medical community began to better understand how to prevent bacterial contamination, which allowed for successful surgeries. At around the same time, the education of doctors was starting to be held to more rigorous standards and became centered around scientific discovery. Doctors were encouraged to present themselves as neat, clean, and scientific, to lend authority to their role as physicians. Next, diagnostic and therapeutic techniques moved medical care from the home to the hospital, which became a place where people went to be healed rather than a place to die. In the hospital, white was to be used by the doctors and nurses to designate those who were in the role of healers. Further advances, such as the discovery of antibiotics in the early 20th century, revolutionized medicine and made previously deadly diseases such as pneumonia curable, and the role of the physician became more vital. The power and respect of physicians grew, as did the symbolism of the white coat that helped define their role. Today, the use of the white coat in the U.S. varies by institution and specialty. As a pediatrician, I rarely wore a white coat, and neither did my colleagues in psychiatry. Typically, the short white coat is worn by medical students, and the long white coats by residents and attending physicians. However, patients rarely know about these distinctions. In addition, if you see a healthcare provider in a white coat now, it may be a physician, a physician's assistant, a nurse practitioner, a physical therapist, or any number of people on the healthcare team. And this speaks to the evolution of our current healthcare system towards team-based medical care. The meaning of the white coat continues to evolve. White Coats for Black Lives, a national medical student movement, began in 2014, seeks to raise awareness of racism as a public health concern and prepare physicians to be advocates for racial justice. Today, more than ever, this symbol of the white coat remains highly relevant to our profession and to society. Because the white coat continues to be a symbol of power, your responsibility is to continually seek to be worthy of it, of the trust of your patients for whom you wear it. The white coat will, over time, gain its own significance for you through the life-changing experiences you will engage in your new identity as a healer. In turn, the physicians you become will continue to imbue the white coat with meaning and significance. In 1927, Francis Peabody, a Harvard physician who found the true meaning of medical practice only after he himself became a patient, wrote, "One of the essential qualities of the clinician is interest in humanity, for the secret of the care of the patient is in caring for the patient." As you don your coat, please consider the commitment you have just made to the care of patients. Going forward, your coat will serve as your library and your mini supply closet with its many pockets, in addition to the symbol of your burgeoning physicianhood. When you first put on your white coat, you will have changed. You will now have crossed over the threshold of the profession of medicine. And going forward, whether you are wearing your white coat or not, you will always know that on this day, you took the step to become a student of medicine, a physician, and to answer the calling with compassion, integrity, humility, and courage, respect, and care for each other as well as your colleagues in the other health professions, and a commitment to a lifetime of learning, curiosity, and joy in the practice of medicine. Congratulations, Frank H. Netter, MD, School of Medicine of Quinnipiac University, Class of 2024. And now, please join me in welcoming Dr. Pham, Associate Dean for Student Affairs, who will present the Class of 2024 with their white coats.
Frank Tavares Mora, Robert Scapitici, Jane O'Brien, Coleman Swayam, Kyle Rigo, Marissa Pietrandrea, Sydney Miller, John Maddow, Natalie Leslie, David Aman, Carlos Echevarria, Rafael Moreno, Kritika Chagari, Olaoluwa Adebayo, Shawnee Green, Ben Gaylord, Justin Badgett, Nora Kelleher, Ron Helderman, Christina Mancini, Kip Hopper, Fiona Evans, John Horn, Maureen DeMarkin, Ali Lonstein, Rahul Patel, Hannah Leahy, Justina Solomon, Ryan Morris, Emily Miramontes, Maisha Savani, Samuel Shu, Davina Matino, Ashley Ward, David Hindman, Hadley Spagna, Lillian James, Catherine Trimbulack, Alexander Hare, Brendan Lilly, Zachary Tochka, Andrew Leo, Madison Masters, Derek Parody, Joseph Carbonaro, Emma Yates, Lori Lateran, Alvaro Nava, Catherine Nichols, Raquel Hoops, Joshua Green, Arth Sharma, Noor Abumatar, Jack Goodman, Rebecca Fang, Jarrett Kelly, Taylor Schofield, Shonake Nugent, Hannah Sir, Biwei Chen, Evan Thompson, Blake Akarulo, Louisa Chepkamui, Osama Elsenkari, Carolyn Conlon, Marcus Alexander, Emma Bergman, Percy Algarate, Josiah Douglas, Samar Dia, Sarah Bart, Ben Braun, Josh Fontaine, John Garcia, Daniel Hecht, Jonah Cremenendez, Kelsey Lasorda, Matthew Bunce, Alex Levine, Kelly Sharp, Joshua Fedorko, Renee Jazanovic, Zachariah Demaris, Jessica Tiber, Marissa Walsh, Ryan Ward, Gustavo Porto, Daniel Regan, Joy Yang, Joseph Petrosino, Romel Noche, Alexander Lau, Iwana Moldovan, Craig Mendonça.
In the midst of a global pandemic that has affected over 52 million people worldwide thus far, you, class of 2024, made a decision to become doctors. It takes a very special kind of person to want to run into the burning building. And in essence, by choosing to join the House of Medicine this year, you are all heroes already. Still, I asked you to consider why you made this life-changing decision on the first day we met in CAS. And I hope it will be a decision that you reflect on often and motivates each of you throughout your careers. Over the last 9 months, since COVID began in the United States, my colleagues in healthcare have worked heroically as we witnessed so much insensible loss, even as we put ourselves on the front lines and suffered considerable losses ourselves. Personally, I lost my dear mother, my beloved uncle, my good friend Dr. Lorna Breen, as well as other close family members and friends. But even more unfortunately, I am not alone. We have all lost something of ourselves throughout this pandemic. It has been a remarkably difficult year to be alive, and especially to work in healthcare. 2020 will undoubtedly be a year we will never forget. And yet, hope remains. Thanks to the marvels of science and the hard work of researchers everywhere, we will have a vaccine, and humanity will thrive once again. Medical school will once again become the buzzing hub of in-person activity and excitement. COVID has made apparent the many flaws in our society and healthcare systems, and so we have a lot of work to do. We will find ways to become stronger, smarter, and more resilient. and each of you will be playing an integral part in that post-traumatic growth. I have found that each year, as I join in on the white coat ceremony, the Hippocratic Oath takes on new meaning and gives me a renewed sense of purpose. It has an especially bittersweet essence this year. And now, I would like to ask my physician colleagues who are here present and the members of the class of 2024 to please join me as we read together the Hippocratic Oath. I swear to fulfill, to the best of my ability and judgment, this covenant. I will respect the hard-won scientific gains of those physicians in whose steps I walk, and gladly share such knowledge as is mine with those who are to follow. I will apply for the benefit of the sick all measures that are required, avoiding those twin traps of overtreatment and therapeutic nihilism. I will remember that there is an art to medicine as well as science, and that warmth, sympathy, and understanding may outweigh the surgeon's knife or the chemist's drug. I will not be ashamed to say I know not, nor will I fail to call in my colleagues when the skills of another are needed for a patient's recovery. I will respect the privacy of my patients, for their problems are not disclosed to me that the world may know. Most especially must I tread with care in matters of life and death. If it is given to me to save a life, all thanks, but it may also be within my power to take a life. This awesome responsibility must be faced with great humbleness and awareness of my own frailty. Above all, I must not play at God. I will remember that I do not treat a fever chart, a cancerous growth, but a sick human being whose illness may affect the person's family and economic stability. My responsibility includes these related problems if I am to care adequately for the sick. I will prevent disease whenever I can, for prevention is preferable to cure. I will remember that I remain a member of society with special obligations to all my fellow human beings, those sound of mind and body as well as the infirm. If I do not violate this oath, may I enjoy life and art, respected while I live and remembered with affection thereafter. May I always act so as to preserve the finest traditions of my calling, and may I long experience the joy of healing those who seek my help. Thank you.
Hello, class of 2024. My name is Zaida, and I am a fourth-year medical student and chapter president of the Gold Humanism Honor Society at Netter. The pin on your white coat serves as a reminder to all who wear it that compassion and empathy are necessary in order to deliver the best patient care, a care that is rooted in respecting a patient's dignity and recognizing them as a whole person. I hope that you keep this in mind and remember it each time you don your white coat and see your pin. I also ask that you cultivate and assign your own meaning to the pin. Medicine is truly a calling, so think of the reasons why you chose to respond to this call and pursue this profession. Think on your path to medicine and all of the experiences that have led you to be here now. Also reflect on the hopes I'm sure you have for your future and the patients you will soon help take care of. Remember that they have been entrusted to you and the importance of this responsibility. I know this is not how you envisioned the start of your medical school, amidst a global pandemic with virtual learning, as well as the racial reckoning our country is going through. However, it does not diminish your accomplishments, nor the significance of your white coat and pin. I'd like to end with the words of the late Justice Ruth Bader Ginsburg. If you want to be a true professional, you will do something outside yourself, something to repair the tears in your community, something to make life a little better for the people less fortunate than you. One lives not just for oneself, but for one's community. Thank you.
Congratulations to the class of 2024. We at Quinnipiac wish you the best of luck on your journey to becoming a physician. Thank you for joining us.